Welcome, everyone. Welcome to Baltimore Data Day. You have arrived at the Baltimore Data about COVID-19 session. Welcome. My name is Delegate Robbyn Lewis. I'll be the moderator for this panel. Thank you all for joining. What you should see on your screen right now is a poll asking you to tell us about yourself. This session is being recorded live, so if you're watching it at some future point, you won't be able to participate in the poll. But if you're with us in real time, please take a moment to tell us about yourself. And we will just percolate for a moment or two while you do that. I think it's a good amount of time. We may get started. So in the meantime, I'm also going to make use of the chat function, and I welcome you to make use of the chat function if you're with us in real time to post any questions you might have, comments, thoughts. We'd love to hear them. If you're joining us on Facebook Live, type in your questions, comments there as well. We have a whole team of folks waiting on every platform to make sure your inputs are received. So thanks. Again, my name is Delegate Robbyn Lewis. I'm your moderator, and welcome to Baltimore Data Day. You are with us in the session on data about COVID-19. It's great to have you with us. I'm going to change my view options a little bit. Well, we have with us today an amazing panel of talented, experienced experts from Baltimore City. And we have with us today Darcy Phelan-Emrick from the Baltimore City Health Department, Emma Moynihan from the Johns Hopkins School of Public Health, Melissa Marx, also from the Baltimore School of Public Health, and Eean Logan from the No Boundaries Coalition. Thank you all again for being here, amazing panelists. We're going to talk about how COVID-19 has altered nearly every dimension of our lives over the last 18 months. And we're going to talk about how Baltimore City, whether the city, the university, and local nonprofits have collected, analyzed, used, applied data to solve problems in the public health sphere and to help communities and community-led efforts respond. So with that, I'll hand it off to Darcy Phelan-Emrick.
Thank you so much, Delegate Lewis. Hi, everybody. My name is Darcy Phelan-Emrick, and I'm the Chief Epidemiologist at the Baltimore City Health Department. And I'm so pleased to be here with you this afternoon to discuss COVID-19 data in Baltimore City. And what I'm going to be doing is a couple screen shares of the dashboards that we have for COVID-19 in Baltimore City. The first one being for the city's overall main COVID dashboard. And then the second dashboard that I'll walk the group through is our COVID-19 Vaccination Dashboard. So right now you should be able to see my screen, and what we're looking at here is our COVID-19 dashboard. The way that you get to this website is typing in up top coronavirus.baltimorecity.gov. And what we're looking at the very first page of our dashboard, our overview, is basically an overview of the overall COVID burden in Baltimore City, looking at it in terms of cases, deaths, and then the percent of COVID tests in the city that are positive for COVID. And a really neat feature of the dashboard is that on these different graphs, if you click within the graph and go to this little expander button and click that, It then opens up the graph so you can take a closer look at the data. You can also hover over the data and see different data points. So the first graph that we have here represents the number of COVID cases by test date within Baltimore City. And this goes all the way back to when COVID pandemic first began in March of 2020. And the data were just updated today, actually. So in the graph here, this is what we call an epidemic curve, and it helps us understand how an epidemic or outbreak is spreading in a population. You can see that we've really had 3 or 4 major waves of COVID. So this first wave, a second wave, this larger third wave, and then a fourth wave. And of course, we've seen a large decrease in the number of COVID cases over the last couple months. So this is what we call our epidemic curve. And again, this is how we look at the number of cases by day. So in our section here, similarly, if you click into the center of the graph and look to expand it, you can again drill into the data and click on a certain data point to see data for that specific day. And so what these data represent are the number of deaths due to COVID in Baltimore City by the date of death. And just sort of eyeballing it overall, you can kind of see the same 4 waves of COVID that Baltimore experienced within these data. So this would be the first wave of COVID, and we know our oldest adults were hit really hard by this first wave of COVID. This is our second wave, and the second wave primarily affected a lot of younger people. So we saw fewer hospitalizations during this time period and fewer deaths as well. And then we had the third wave of COVID and then our fourth wave of COVID. So you can see a somewhat similar pattern as to the epidemic curve, or the curve here represented by the number of cases. Now I'm going to reload the dashboard because I selected a data point in one part of the dashboard. It filtered the whole dashboard for that data point. So I'm going to reload it so we can take a look again at the main overview. And what's going to show here on the left is what we refer to as positivity, test positivity. And what this represents is looking at the overall number of tests on a given day and what percentage of those tests tested positive. And so again, if you click into the graph, oops, window too small here. Actually, I lost my window. Let me go back. Again, if you click inside the graph, you can expand it and take a closer look at the data that you're interested in. So this is our overall COVID dashboard, but there's lots of details here that you can take a look at and dig further into. You can navigate the dashboard by clicking the bottom buttons, the arrows at the bottom here, or you can take a look at this menu and click on the drop-down menu and select something that you might be interested in. So for instance, if we want to take a look at demographics overall, we select that from the drop-down menu, and then we click our Go button. And I know it's hard for you to see on your screen, so I encourage you to check this out. But what we have here basically are demographics for various different measures of COVID, broken out by age group, ethnicity, race, and sex. And so the first piece of information we have is simply the number of cases for these different demographic groups. The next piece of information we have is the number of cases per 1,000 people. So what this does is it tells us it's a per population measure. So whereas the cases is just a raw count or a raw number, the cases per 1,000 is a rate that helps us take into account the population size. Similarly, we have information about deaths due to COVID broken out by our age, ethnicity, and race groups. We have a death rate as well. And then we have something that's called case fatality rate. And this is a measure in public health that helps us to understand among all of the people who have a certain illness, what proportion of people pass away from that illness. And so when we look at our case fatality rate, and you can see that it's highest, it's this 22.4% among our oldest adults. So the way that you would interpret that would be to say, among Baltimore City residents who have COVID, who are ages 80 and older, about 22.4% of them passed away due to COVID. So that's what case fatality means. And then here we have information about the number of tests by different demographic groups, breaking down the number of tests by the population size, so per 1,000, and then also looking at the test positivity. So among a given demographic group, what percent of those tests had a positive result? So we have lots of different things on the dashboard that may be of interest. One thing that I want to point out is hospitalizations, because those have been really important with COVID. On our hospitalization page, we have information here on the left in the center tile here that represents overall the number of COVID hospital patients in both an ICU or acute care bed setting, as well as just a regular hospital bed setting. And you can see really, this was our first wave of the pandemic, second wave, third wave, and fourth wave of the pandemic. And now we're really almost at an all-time low in terms of the number of folks within Baltimore City who are hospitalized for COVID in the ICU or acute care setting, or just in a regular hospital bed setting. The data on this tab get further breaking out if you want to look at ICU acute care, ICU care unit, or if you want to look at the acute care setting. So I encourage you to check that out if you're interested in those breakdowns. Another thing I wanted to point out on the dashboard that I find to be really helpful and interesting is this tab of the dashboard that we refer to as our cumulative incidence rate. And an incidence rate is a measure that we use in public health to basically represent the number of new cases of a given health outcome within our population. So it can really help us understand how quickly a certain group is being affected by a given health outcome. So here we would be talking about COVID, of course. The graph here is our cumulative case rate by race and ethnicity over time. And so here we can really see how different groups have been affected disproportionately by COVID. So when we're looking at this graph, one thing that really sticks out is this pink line here. This is our cumulative case rate for our Latinx or our Hispanic population in Baltimore City. We know that our Hispanic population has in particular been disproportionately affected by COVID, as well as our other communities of color. So that really stands out here. Let's see, this overall dotted line, black dotted line represents all of the groups combined. If we want to look at race, for instance, black versus white, black is represented here in this yellow color. And then if you click on a given point and you can hover, you can find the certain values. And if we want to compare that to white, that's represented by the blue line down here. And so we can really see the disproportionate impact among African American and Black residents in our city based on this graph. So this is what we refer to as our cumulative incidence graph. And there are other things on this dashboard that I'd be happy to talk about. I do want to go to our vaccination dashboard, however, and show you some of the information there. And the way that you get to our vaccination dashboard is, again, you go to coronavirus.baltimorecity.gov, and if you scroll down, you can click on this COVID-19 vaccine information. A menu will pop up and you'll see an option for the Baltimore City Vaccine Dashboard. That's my 5-minute warning. And then if you click here, that will open up the dashboard. And so it sometimes takes a minute to load. So I'm going to actually switch to the already loaded dashboard so we can take a look at this together. So what we have here is our Baltimore City dashboard for COVID-19 vaccination. And what's really important to know about these data is that the focus is Baltimore City residents. In this first tile here we have in the center left, these are just the simple counts of COVID-19 doses, and based on a first or single dose of COVID-19 vaccine, and then based on the age group. So if you're interested, you can click through these arrows and take a look at the numbers for different age groups. So among all ages, the number of Baltimore City residents who are fully vaccinated against COVID-19 is about 273,000. So that's a lot of people. And if you want to know, well, actually, what percent of the population does that represent? That's what we have down here in the bottom set of tiles. So similarly, you can click through and it'll tell you fully vaccinated. And if it's all ages, ages 12 and above, or ages 18 and above. But if we want to make a comparison, so fully vaccinated all ages, we can look here at fully vaccinated all ages. That represents about 46% of Baltimore City residents. So these two tiles, this one here represents the number of doses, and this one here represents the population coverage overall. And again, you can click through and take a look at, does it say fully vaccinated or does it say first or single dose? First dose refers to the first dose of a 2-dose vaccine series, so either the Pfizer or Moderna series, and then single dose refers to the Johnson & Johnson vaccine. The next thing I'd like to highlight in the dashboard is this graph that we have here in the top center. And this graph represents our cumulative number of doses of first or single dose or fully vaccinated over time in Baltimore City. One feature of the dashboard is that you can click on a corner to expand the information, and it provides some additional detail. So represented here in the blue is the number of first or single doses by day, and then represented in the yellow is the number of fully vaccinated individuals by day. One thing that really is apparent when you take a look at this graph is you can really see that earlier in the year, in the spring, we really had high uptake initially of our COVID vaccine, which is what we've all been hearing about and talking about with our family and friends. But the number of new doses has really started to plateau over time, so that you can really see that in this graph. The set of tiles here on this area, this represents the number of doses broken out by different demographic groups, looking at first or single dose or fully vaccinated. You can click through and take a look at these. One thing that I find to be extra helpful is the tile here next to it, because this tile represents the percent of population coverage. So it basically takes into account the number of vaccines, but also how large is the population size. So for instance, in this graph that we have here, I know it's hard for you to see with the labels. This is by age group, and this most right side of the graph represents older adults in Baltimore City, ages 60 and above. So for this age group, what represents the blue bar is to basically say about 74% of older adults in Baltimore City, ages 60 and above, have received a first or a single dose. So that's about 3/4, that's great. When we look at the yellow bar, fully vaccinated represents about 68%. And you can click through and take a look at the data by gender, race, and ethnicity. And I know that I'm just about out of time. What I wanted to finally mention is the map that we have on the dashboard. And this map represents fully vaccinated according to zip code. So this is a map of Baltimore City and its major zip codes. And you can click on a given zip code and a pop-up will show you the zip code itself, the number of first or single doses, the number of individuals fully vaccinated, and then the percent of individuals fully vaccinated. And then you can click on this bar up here in the corner. This gives you the legend for the map. And so this will tell you that the lightest color represents 19 to 31% of fully vaccinated coverage. and that the darkest color in the graph or in the map represents the highest fully vaccinated coverage. And you can see which zip codes these are by clicking around on the maps. So I know that I'm out of time. Hope that you've found this helpful, and I'll be happy to answer any questions when they come up. So thank you so much.
Thank you so much, Darcy. That was a terrific presentation. Thank you for running us through the Baltimore City Health Department's COVID Data Dashboard. And I'll just mention that during the height of the pandemic, through all the waves last year, I frequently went to the Baltimore City Health Department COVID page to understand what was going on, to see what the trends were. So thank you. There are a couple of questions, and I hope it's all right if we answer them now before going to the next panelist. A few great questions in the chat. So the first question for you, Darcy. Does Baltimore City's pattern of cases, those 4 waves, do they correspond to waves in other cities? How do we compare?
Yes, they absolutely do correspond to what other cities experience. So there is a little bit of variation. There is a part, actually, I don't have it open. There is a part of the dashboard that compares Baltimore City to Maryland overall and to the United States overall. So you can see how the waves differed between the city, Maryland, and the US. So there is some variation, but yes, Baltimore's experience was quite similar to those of other cities.
Thank you. Next question.
Yeah.
Thank you. And that first question was from TJ Butler. Next, Catherine Tartaglia wants to know more about the data sources. Where does the health department get all of its information about COVID?
Wonderful. So the health department gets just about all of its information about COVID from the Maryland Department of Health. So the Maryland Department of Health provides the Baltimore City Health Department with information about COVID cases, as well as deaths, as well as testing, as well as hospitalizations, as well as vaccinations. So basically all of the data that are represented on these dashboards are provided to the Baltimore City Health Department by the State Health Department.
And how often are those data updated?
They're updated.
What limitations do they have?
So they're updated Monday through Friday. So on a daily basis, Monday through Friday. Some of the limitations are there can be a delay in reporting. So for instance, in particular with COVID test results, different labs have different turnaround times. And so sometimes some labs take longer to report to the state than others. There can be a delay with some of the test reporting data. Another thing that can happen is sometimes cases or observations will be assigned to Baltimore City, but it turns out they actually live in a different county. And so the health department has a process to reconcile that with the state health department, because we only want to count and be accounted for Baltimore City residents. So that's another limitation, but we work on resolving that with the state health department. And actually, on the city's COVID dashboard, there is information on the last slide of the dashboard that lists all of the data sources. And within our vaccine dashboard, one of the tiles lists the data sources as well.
Terrific. Thank you so much. Thanks again. Darcy is the Chief Epidemiologist for the Baltimore City Department of Health. And thank you so much. Any other questions pop up, feel free to share them in the chat. With that, I'd like to go to our next panelist. Emma. Hi, Emma Moynihan from the Johns Hopkins School of Public Health. Take it away, Emma.
This is Melissa. I'm going to start with a brief description of the group that Emma is a part of, if that's okay.
Absolutely.
And, I'm just going to share my screen and put it in presenter mode. Excuse me for that. Can you see my screen?
Yes.
Yes. Great. Well, I am really happy to be part of this panel and to introduce Emma. And Emma's a part of a group at the Johns Hopkins School of Bloomberg School of Public Health called the Surveillance and Outbreak Response Team. And this is a group that has a dual purpose. It's PhD students and postdoctoral students who are learning about epidemiology and learning about public health at the school. And they're also interested in applied public health, applied epidemiology. And so we, my co-lead and I, who I'll mention in a moment, have the pleasure of introducing them to applied public health. And at the same time, we're trying to serve the needs of Maryland State. Particularly, we work closely with local, state, federal, and right now even multilateral practitioners. So from counties within Maryland to the state of Maryland to CDC to WHO. And our students and postdocs get involved with these entities, and they assist them with special deeper dives maybe into their data, or assisting. Usually some of the smaller health departments can sometimes ask for help to look geographically at outbreaks, or to learn a certain skill that they might not have the expertise in. And so our students learn what it's like to work in real public health, and the health departments that request our assistance get more person power, and in some cases, more up-to-date methods of analysis than they might have. The Baltimore City Health Department is quite well taken care of under Darcy's leadership, but especially during the COVID outbreak and the COVID pandemic, they could use our help to have a few extra pair of hands, because it was quite busy. Even before the COVID pandemic, our group worked with the Maryland State Health Department on things like Legionnaire's outbreaks, on helping with swabbing residents of facilities where they had drug-resistant infections. We've worked with Baltimore City as well on hepatitis A. And but really, we went into high gear, and we were really pleased to be invited to work with Darcy and her team during COVID. So our group is led by Emily Gurley, Dr. Emily Gurley, and myself, and we have now a very active team that meets with Darcy weekly or bi-weekly, and we support different analyses. And I'm really pleased to introduce Emma Moynihan, who's a doctoral student with us, who did a particular kind of thing called a practiceship with Darcy and the Baltimore City Health Department. And one of the things she worked on is what she's going to present today. And I'll, without further ado, you can find more information about SORT if you just Google SORT, S-O-R-T, and the Johns Hopkins School of Public Health. But I'm going to now turn it over to Emma to give her presentation.
Great. Good afternoon, everyone. I'm Emma, and I'm a PhD student at Johns Hopkins. And today I'll be talking about some work we did recently looking at differences in COVID-19 vaccination by race in Baltimore City, particularly earlier in the year when vaccine supply was more limited. So this spring, multiple news outlets picked up on the fact that high proportions of white Americans tended to be getting the COVID-19 vaccine compared to persons of color. And I found some news articles here showing that, and there's a local news station that picked up on it too, based on the dashboard that Darcy kindly showed us earlier today. So specifically this spring, there were 2 to 3-fold differences in Black residents of Baltimore City receiving COVID-19 vaccination compared to white residents. For instance, if you look at the graphic on the slide, 70% of the people that were receiving vaccines in April in Baltimore City were of a race other than Black. what we wanted to understand is how the use of different population denominators might impact the extent of these differences. I'll explain. We assumed that the total population of Baltimore City residents eligible for vaccinations reflected the same racial demographics of the city at large. That's roughly 60% Black and 40% other races. However, we didn't actually know if that's the case or not, if that's true. So why might that not be the case? Well, when we were looking at these differences in vaccination back in early in the spring, not everyone was eligible as they are now in the sense of adults over 18. Instead, it was just phases 1A through 1C, which is in this graphic on the slide. It's small, but if you want to look at this in more particular, there's a URL available. And so what we wanted to know is whether these groups of phase 1A through 1C, which are largely people eligible due to health reasons or employment, are these individuals overall representative of Baltimore City, being about 60% Black and 30% white, or are these groups have a different racial demographics, which might be driving some of these differences that we're seeing? So that's what we wanted to look at. So our main question then was, how many people are eligible in Baltimore City under phases 1A through 1C? And how many of these people were Black residents compared to white residents? So we had a number of steps in order to try to figure this out. So one of our main data sources was the US Census Bureau's American Community Survey. And from this, we were able to determine both the number of residents that were eligible under phase 1A through C and their general race. We looked at this by specific subgroups in each phase. So I listed some below, such as adults over the age of 65, adults over the age of 75, and then some particular employment. So doing that, we were able to come up with roughly 148,372 individuals. Now, this estimate also comes from the Maryland Department of Health, which had an estimate of who they thought would be the total number of residents eligible for vaccination, but they didn't have race data. So if you remind yourself of this prior slide, there were a lot of groups that were eligible. So we weren't able to count all of them, but we were able to count most of them. And so we ended up being able to count about 120 of the 1,000, and that left about 27,000 that we still needed to estimate the race of. So yeah, you can see the slide here. So we were able to enumerate 120,000, and then 28,000 we were not able to enumerate. So what did we do about these 20-odd thousand that we were unable to count? Well, we wanted to see, we applied a series of scenarios here. So we wanted to imagine what would happen if we made some estimates based on what we think that population might be. So in the first case, we assumed that those 20-odd thousand resembled Baltimore City overall, largely 60% Black and 30% white. But then we also ran scenarios where we assumed that that the group was 80% Black and 20% white, and then likewise 80% white and 20% Black, just to see how different our results based off of these estimates. And what we found actually was that the racial demographics of Baltimore City's population eligible for vaccines just under phase 1A through 1C really represents the demographics of Baltimore City as a whole. And so the table presented here shows the estimated percent and number of Baltimore City residents in vaccine phases 1A through 1C by race. And the important thing I want you to take away from here is that regardless of the different scenarios we use from that last slide, the results are really similar. You'll still see that for the most part, it's a majority Black residents that are eligible compared to white residents. So before I talk about what this means, I just want to acknowledge some limitations about the data. So first of all, we don't have detailed data on races other than Black and white do know that about 10% of Baltimore City's population doesn't fit into one of those categories. Secondly, the 148,000 estimate I mentioned of the total residents eligible for vaccination under phase 1A through 1C is an estimate that comes from the Maryland Department of Health. So it could be actually a number that's smaller or larger. That being said, our results do show that these observed disparities in COVID vaccination by race aren't affected by correcting the denominator. And we need to think about what these results mean. So why do we care? Well, first, it's important to keep track of who's missing out on life-saving interventions. We want to be able to track this data as in real time as possible. But it's important that in public health, we only include those who are eligible or in the numerator in the denominator. Put another way, if there's a health intervention available for only children under 18, we wouldn't want to count all adults over 18 in the total number of individuals eligible for that intervention. Furthermore, we've seen some talk of COVID-19 booster shots, but in addition, other phases of interventions for COVID-19 or other phases of health threats, it's important that we end up using the right denominator when we're thinking about how we're reaching people. So thank you so much. This concludes my presentation. I'm happy to take any questions, time permitting, and I also have the link to the COVID-19 Vaccine Dashboard that you can visit. Thank you so much.
Thank you so much, Emma Moynihan, PhD candidate at the Johns Hopkins School of Public Health, Bloomberg School of Public Health, and also to Professor Melissa Marx, who is also with the Hopkins School of Public Health. I'm kind of old school, by the way, guys. I still call it hygiene. I'm like, you may not have ever heard of the school referred to that way, but it's really a pleasure to have you both. And thank you for that epidemiological overview of COVID in Baltimore City. Let me just check the chat and welcome participants who have questions to enter them in the chat, whatever platform you're on. I'll also share that if you are able to access the chat, you'll see that there are links posted there. You can view a couple of references, and we provided the EPI department's tracker. You can view that, and she also kindly provided another link to the City Health Department's vaccine phase groupings. I'm not seeing any fresh questions in the chat, but I'm curious, Emma, if you could share, you mentioned that although Baltimore City's population includes about 10% of residents who fit neither the African-American or Black category or the white category, that 10%, can you tell us anything about that group?
Right. So we do know, based off of Darcy's the Baltimore City's Health Department's vaccine dashboard that Darcy just showed, that some of these groups we know do have some higher rates of, for instance, having had COVID-19, like the Latinx community. Unfortunately, with the that we use that comes from the U.S. Census is just limited in the data that's available, particularly when we break it down more than just by race. We are able to look a little bit at other sources of information to try to understand that population.
Will it be of any use to further understand that 10% of the population when the new census results become available later this year? Will you be able to look back and interpret with any more refinement?
No, I don't know when the new census data is out. I'm not sure if they'll have in more granularity or not, or if it will just be an update to the similar to what we already have. But regardless, I do think it's important that we have more detailed data because that 10% of the population does really matter, and they do have different trends. And I think it calls for more data for public health interventions.
Thank you. One last question. How do you explain the disparity between African-American eligibility for vaccines compared to their actual access to vaccines?
Yeah, I think that's a great question, and I think it's a challenging one to answer. I think there are a couple of things that could be going on and that we're not, totally sure about. One could certainly be an access issue. So, for instance, if there was challenges to get to a vaccination site, that might be driving some of this. But it could also be differences in vaccine hesitancy. So there might be reasons why Baltimore's Black population might be more hesitant to get the COVID-19 vaccine than others. So it's hard to say it's just one thing, but I think it's important to look into that and see what we can do to increase vaccination.
I'm curious about access, just to hone in a little bit further. What should, or are we doing in Baltimore to break down barriers to access? And that might be a question for you, Emma. Darcy might also jump in. How do we reduce obstacles to getting the vaccine for people who want it, especially for those at highest risk of COVID disease?
Thank you. That's a great question. I think I will sort of defer to Darcy on this one, just because she's more up to date on all the amazing work that the City Health Department's doing. So I don't want to speak for them.
Yeah, happy to answer your question, Delegate Lewis. It's a great one. The Health Department has multiple approaches to conducting outreach and trying to reach groups that have had lower levels of vaccination. So we have a public health COVID vaccine ambassadors program where we do some outreach at specific events and even some door-to-door canvassing, letting people know about different vaccine clinics. We provide free transportation to people. If they need help getting to a clinic, you can reach out to the health department and arrange for transportation to get to a clinic. We're trying to reduce transportation barriers. Also doing some mass communications and mass education on COVID vaccine and recognizing the reasons people have hesitancy, trying to answer their questions. I encourage folks to check out the health department's Twitter feed. We have a really frank discussion about concerns about the COVID-19 vaccine, and I think, and have some fun too, and some back and forth about that as well. So we really have a multi-pronged approach, and a lot of it is trying to meet people where they're at, providing help with access, helping to address vaccine hesitancy, and really trying to reach folks who are at highest risk for severe COVID health outcomes, like older adults who haven't been yet vaccinated, or people who might live in congregate settings.
So it sounds like what you're describing, Darcy, are public health efforts to address inequities in healthcare access. For months, we had mass vaccination sites in Baltimore City. It was the M&T Stadium, if I'm not mistaken, where the University of Maryland set up mass vaccination deployment. But if you couldn't easily get to that location, obstacles in transit or work schedule conflicts, you couldn't get there when they were open. You couldn't get a vaccine. But the health department and other partners like Johns Hopkins, like University of Maryland, have come together to break those barriers. And if I'm not mistaken, isn't there a mobile van program that the health department's running?
Yes, yep, we do hold mobile vaccine clinics around different parts of town. And so you can learn about those by checking the health department's website and also checking social media feeds like Facebook and Twitter. But yeah, we hold on a weekly basis, sort of pop-up vaccine clinics in different communities in terms of our mobile response options. And we're also helping people who are homebound, going to them to help them get vaccinated.
Thank you. It's great examples of public health in action. Thank you all once again. I'd like to jump to our final panelist, Eean Logan. Eean is the director of, Eean's the director of Civic Engagement and Youth, and the Youth Program Manager at No Boundaries Coalition, a Baltimore-based nonprofit. Eean, please take us into your presentation. Thank you.
Yeah. Can everybody see my screen? All right. So this is, let me stop my timer because I don't want to go over time. Hi, everybody. As introduced, I'm Eean, and we also call it Civic Culture over here at No Boundaries, just because we really like to think that the things that we are doing with our residents is embedding civics into the culture of their everyday living. So this is just a picture of our youth, and I definitely will be speaking from a community-based lens. So it'll be a little bit about what No Boundaries does, as well as how we use data so that you can kind of see, hopefully, while we are here and while we're presenting during COVID. And just a caveat that I will say that a lot of what we didn't change. And I hate to preface that because I know that this session is about what changed during COVID. But as a community-based organization that does primarily outreach around sharing resources and providing residents with resources, we constantly did that a little bit double time. So just to talk about what we'll talk about today, this is an agenda. And like I said, it's always gonna be a little bit about No Boundaries. So if you have questions about us, please also let me know. And I'll try to monitor the chat. Maybe if you all, I guess we'll do questions at the end as well.
I'll help you with the chat, Eean.
Okay.
Collect the questions till the end. And I did, sorry to interrupt your flow. I did get a chat message that they're having a little trouble hearing you.
Oh, that could be, is this better? I know my...
That's much better.
Okay, perfect. I'm sorry about that. I'm working on getting a new laptop because...
You're doing great.
All right, so just to keep it going, I will be talking about past, present, and future uses of data at NBC. So just to overview really quick, like I said, our mission is that we are a resident-led advocacy organization focused on building a unified and empowered Central West Baltimore across the boundaries of race, class, and neighborhood. So you could imagine, obviously, having a good understanding of the makeup of our neighborhoods is beneficial to our work. So that's one of the biggest ways that we use data. And then I'll have a small focus on our youth program because, as we mentioned, that's something that I do at No Boundaries. I could do missions for all of our programs, including our health and food justice, which also really ramped up during COVID. So one of the earliest forms and interactions that No Boundaries had was one of our reports that really informed the consent decree. So Ray Kelly and a lot of No Boundaries members before me helped to create a listening campaign that really outlined and had findings of what was going on in 21217 in Greater West Baltimore around police misconduct. So just to give you an idea, this is the history of No Boundaries. We are always in the streets, talking to our residents, finding out what issues are most important to them. So I just wanted to share that this is also on our website, something that you can actually read now. And just to give you also some more history of like how hard we have, that's one of the biggest things that we do at No Boundaries is to collect our peers' voices. For young people, it is their peers in high school, middle school, and finding out what issues are important to them. For just the residents and staff members and members of the organization, we are always conducting listening campaigns. So that's what I'll be talking about, is just to give you overview and let you because I wanted to talk about a few different things that some of the other panelists mentioned. And I definitely want to applaud the health department. And actually, I think I know at least one of the ambassadors on the vaccination outreach. If I'm not mistaken, he could be working with another in the mayor's office. But those are things that No Boundaries has been doing since COVID, is sharing information around, just updating folks and letting them know where they can go for resources, whether it was housing resources during COVID and you needed to get rental assistance or different things like that. So I'm gonna get to those slides, but I guess I just wanted to show how in depth No Boundaries does go into data. And this is actually a project that we worked on with Open Society Baltimore, and the data was made available through the Baltimore Neighborhood Indicators Alliance. So in talking about, this is more, I like to think this is kind of the present, even though this was about 2 years ago. And why I want to show this is because as I talk about our future in data, No Boundaries really wants to be at the forefront of, being a resource for data, whether it's on voice. So literally, what do our residents feel about policing and public safety? What do they think some of the solutions should be around housing or economic and community development? So in any given time, just like on the I think it's Open Society website, you can go right there and find this information. And I know in the future, No Boundaries wants to have some of this type of information for our zip code readily available on our website. Things like voting numbers, census data. We really want to have that access easily digestible for, I was gonna say, for folks like our Black captains. This is actually from our Black captains graduation. And what we do a lot of is, just like with our youth program, we really try to equip residents in 21217 with the ability to conduct campaigns. Literally, this is like expectations that we have of them. So with all of the data they have to identify issues that they want to work on. And just like, it's funny, I'm a student, I'm actually attending school right now. So, and just like how we do case studies and all of those different things, we want our residents who might not have gone to school, they might not have a degree, they might not want to go, but we like to think that we serve as that gap, to where if you want to learn more about this information, if you want to partake in these things, these are the expectations that we have by the time you finish a Black Captains program or finish our youth program. So all of the things that everyone shared today, and I always feel like a little insecure sometimes following such great data presentations, because we're not where we want to be with being able to show and analyze the data, like, our epidemiologists and those that really understand and can, I guess, sort the data. But one thing that we really are good at this point is literally just producing the data. So we are out there in the street and we collect what folks say. We collect their thoughts around solutions, their issues that are important to them. So around COVID, we really did still do community outreach. We had different events where we had on PPE. I still did census outreach during COVID, voter registration, all of those things that we still did. And while we were doing it, we didn't, neglect that COVID was going on. We often had sign-in sheets and folks that if you had resources that you needed, you would identify that on a piece of paper and we would do follow up. So that is something that we dream of doing more case work, where it's like one-on-one and individual. But as you saw in our mission, that's not what we do as an organization. So although we are more on the advocacy side and making sure that our elected officials understand what our residents' priorities are, we still try to serve in the gap of, if you need a resource, we also still want to direct you in the right place. And in that sense, we also we want to be able to train our Black captains to do it so that we're magnified across spaces. So to speak, I guess, directly to just some of the things that changed in COVID, we did go online, but for a little while, like literally a month or two. But during the school year, we still met Tuesdays, Thursdays, and Saturdays for our youth program. Our Black captains still came in for volunteer opportunities, and they didn't volunteer with us because we didn't necessarily like have food giveaways or different things like that I know a lot of organizations did, but our Black captains had to serve as volunteers. So we didn't necessarily go offline. And then I think I have a few more minutes. I won't, this is just about our organization, because one of the things that I think I also want to touch on is that how we use data. So once we also really use data to inform our programs. So what are things that help students receiving stipends, or making sure that they have mentors, or making sure that they take trips, and all of the data around those we also want to collect and be able to use and give out. So I just put our incentives here, and a lot of times the data that we have, which I don't have a slide on the, you know, why we do these things, but in our research, they've, you know, told us that making sure that you make sure you feed students, pay students, give them mentors, and all those things. That's why this is here. So I just wanted to say thank you, and I'll get to that part, because there's one last thing I wanted to touch on that was mentioned from one of the other panelists, I believe was, you know, just identifying data sources. I'm sorry, I'm looking at my notes because I was like, oh man, somebody made a really good point. But I know around pretty much COVID, we really didn't necessarily have access to, or the capacity, I would say, to look at the data. But I do know once the vaccination started rolling out, we've been able to learn more about what communities or what areas in our zip code that have not necessarily accessed the vaccination. And I think it was Emma that mentioned it's not necessarily just the access, because we also have identified, you know, people that have come to our communities to do vaccination clinics. Like John Hopkins has done it, University of Maryland, literally on Lawrence in Pennsylvania, at Legends Park, or at the Triangle. We had partnerships at our block party to get folks vaccinated. But it's a, sorry, so I have like, I think 3 more minutes. But I definitely do want to speak to that point of, that's, I think, the next step is really making sure that we have the education, which is the age-old problem. I feel like educating our residents on the importance of being civically engaged, and I think the vaccination is just another part of that. We're trying to get over the hard to persuade community, that hard to persuade barrier, or just the belief, because I think also just building that trust. So that is something that also No Boundaries is doing, as we see what areas, literally what hotspots either have been affected or are not going to get the vaccination, even though it could be down the street. If John Hopkins comes to them tomorrow and says, hey, we're going to set it up on this corner, folks coming out the house like, I'm gonna just, you know, go about my day. How is it that, I mean, how do we, and I love that we'll be doing door knocking and different things like that, to make sure that we at least present the information. So as residents have those questions, they can't say they didn't know, or were confused or anything like that. So I feel like, I'm sorry if it was a little bit all over the place. I wanted to make sure that you had a little bit of information about No Boundaries, what we've done as an organization, and how we hope to use data. So, and I know I touched on COVID. So thank you all for your time. It's always a pleasure to get to speak on No Boundaries. And I think that was the last thing I did want to end on, is that we are sending our students to No Boundaries. I spoke on trips and things that help our students, you know, become just better citizens. And the more interactions I feel like they have with all types of people, really help them just be well-rounded. So I'll put this in the chat, because we are still trying to fundraise to get them there. But please, if you have any other questions, if you want to be involved in some things, because we actually are doing a survey currently on changing the narrative around gun violence. So I'll stop there. Please, if you're interested, I'd love to get to know you and learn more about what you're working on as well. So stop there.
Eean, you did great. You did fantastic. Thank you so much for coming to speak with us about the important work that No Boundaries Coalition does. You guys are a fantastic organization. I wish we could clone you and put you in different places all over the city. I also, just between us, Eean, I just want to say, never apologize for the work that you do. your contributions are just as important as a professor emeritus at the greatest university in the world. Remember that your connection with the community is what makes all of the other work possible. So you did great. I have a question for you. Could you talk with us a little bit more about the surveys that you conduct at No Boundaries? A lot of people in Baltimore, especially in some of our communities around research institutions, they are tired of being researched. They get really burnt out being asked to do surveys. So talk about the surveys that you did, Eean. People often don't want to respond, and it's hard to get a lot of information. So how do you make your surveys work?
Yeah, so honestly, it's been fun doing the surveys, and I think the Open Society Blueprint for Baltimore was the like most fun and most that I learned. And the biggest thing that I learned was that residents do really care. They want someone to speak to them. They want them. They almost want you to give them your undivided attention. So from the beginning to end, we always were transparent about what we were looking to do, what we were hoping to gain from the survey. Like from the beginning, like we were asking residents, we had flyers about the whole thing, and we've been doing it that way since. But hey, we need residents to help us create a survey. So we had survey design workshops where residents actually came together with with me and the esteemed professors and folks that developed the survey, and we worked together to come up with questions. Professors were able to tell them, and I forget their actual term, but we're saying professors because I forget their actual term, but they work for firms that do this all over the country. And they would just let residents know, like, hey, this is the type of questions that we need to ask. This is how you ask that type of question to get this certain answer. So we had 4 of those across the city. And then after that, we continued to create buy-in. So we had residents, we actually hired people. We hired over like 10 people to actually help us conduct surveys. Each organization was able to hire their own folks. So then we had residents that just came off the street and were like, okay, I can understand why you guys want to do this. And of course they want to make a couple extra dollars, but they were passionate, almost just as passionate about the survey as we were. Because I also want to say that it was a 36 question survey. And then the survey we're doing now is 29 questions. So honestly, I think, you know, when you have a longer survey, people understand like, okay, you're serious. Like you really are concerned about what it is that I have to say. And not just what I like, as far as I'm complaining or anything like that, but you also are wondering what my solutions are. So you really, and of course we do a lot of one-on-one. We have it online, but a lot of times we're in the streets, like face to face, talking to people like, hey, no, I need 5 minutes. And then I'm talking through the survey with you. Like, all right, what do you think about question 6? Or what did you think about question 10? And it really becomes a conversation and all of those things. And some people we actually follow up with and say, hey, you seem really enthusiastic about the survey. Do you want to come to a meeting and share, or do you to make sure that you're at the actual like for one, we had a mayoral forum based on the information, and that's why I was able to show the graphs and the charts of this is what folks in 21217 said, or folks on this side said about this issue. So I think really engaging people with the intention to say, hey, you are informing something. You're informing whether it's policy, our next mayor, these things, like you're talking to me, and I'm going to make sure that this is recorded in these things, and we really do. Like we had a whole mayoral forum, you know, reflecting on this is what 20% of the 5,000 people that we surveyed said, and it was broadcast, and it was all of those things.
So are you saying, Eean, that the information that you collected, you also shared with the residents? Did they get to benefit from the knowledge that you gained? Was that of your mission?
Yes, ma'am. Because pretty much every time we've done it, residents have been able to see the outcome. Before I was even there, and they did listening campaigns on what are the top 3 priorities No Boundaries should work on. I think was youth programming, food insecurity, and police brutality. When you look at No Boundaries, we have a market in the Upton Avenue Market. We have a good youth program that's been running for about 5 or so years. So, and we always go back and are telling our residents about, hey, we listen to you, this is what we're doing. With this gun violence survey, we're actually going to put up billboards. We're going to have focus groups with our elected officials, and it'll be another time for us to say, hey, we listened to you all. This is what we heard, and this is the outcome. So kind of just engaging them throughout the whole process and making sure that they see the tangible benefits afterwards.
Right, that's important. We're just moving into the final question and answer phase of the presentation, and I would welcome all of our wonderful panelists to come back on and be visible so that folks can see your wonderful faces and get inspired to ask more questions. Just to maybe tie a little ribbon around Eean's presentation, I'll just ask you one last thing, Eean. We talked earlier in the workshop here in the seminar about vaccine hesitancy, getting back to COVID. And I'm curious to know from your perspective at No Boundaries Coalition, did you perceive or find in your surveys any evidence that vaccine hesitancy, that is fear or mistrust of vaccines, was preventing your residents from getting that protection? Like, did people say to you, I'm afraid or I don't trust it and I'm not going? Did you find that, or is that a myth made up by Fox News?
I would say it's not a myth. We honestly have not made it a priority just yet to go out and do that type of surveying to where we collected the data on it. I'm interested to see if that's something we should do. If folks feel like that is really important. I feel like we were waiting to see exactly the rollout of the vaccination to make sure it wasn't an access thing. Now I feel like you can clearly see or hear whether it's I don't want to go take it or I can't take it. And to answer your question candidly, like when I'm having my events and I'm on the street, we're talking about it. Yes, it is not a myth. That's when I said the age-old statement, I was saying that folks just don't trust the government. I still get, I'm not going to vote for what? So those things aren't a myth. People are still, it's funny, sometimes you interact with some people and you would have never known that they knew about the Tuskegee experiment. You're like, whoa, where did you hear that? But it's true. And it's like, no matter where they got it, they have heard it, and they are aware of these things. So
there's a question of trust in big institutions, but it sounds like the difference that you're making at No Boundaries Coalition is that you're embedded, you're in the community, and you're trusted. So you're able to collect information, collect data, use it to run No Boundaries well, and also use that information to inform other partners so they can do their work well, serve community well. Thank you. Thanks a lot, Eean. Everybody sign up to mentor Eean's youth, what are they called? Youth organizers.
Yep.
Thank you. I'm just checking the chat box to see if we have any more questions. TJ Butler had a question to Eean. What were some of the specific ways that survey results were communicated back? So how did you communicate back to residents in No Boundaries?
We had, we did forums. So we had about 2 different forums where we had elected officials in, and we actually, like, we bussed folks to our mayoral forums. And once they got to the mayoral forum, we literally talked about the information that was on the reports. We also conducted outreach where we had the forums just on tables, the same places that we went to collect information, we went back to when we were just tabling. So we always do outreach because we're always selling produce. We are always looking for students to, enroll. So at the same time, we told people about it. We were also in the paper about it. Like, I think I have a picture of it. I don't know where. I should start including it in my slideshow. But we were on the Sun, and then at our monthly membership meetings for about, I think the time we were running this, I gave updates. Like, before we even had the report, I gave updates on the information. So kind of the same way we collected it, we went back out and gave those updates, and then in our forum. So we always offer rides to the polls. So we gave rides to folks that wanted to hear directly from the candidates and things like that.
That's great. So there were 3 ways: face-to-face, like you one-on-one with people, and public forums where you invited people to attend, and you even gave them rides so they could be present at the. So that's what I call outreach. That's fantastic. What about print materials? Did you have like a pamphlet or brochure printed out with the results to send out? Is that something?
You said something. You said the first word was it appointment?
Print materials like paper.
Oh, materials. Yes. Yeah.
Yeah. Did you do that also?
Yeah.
Yeah.
Definitely.
Okay.
We didn't send it out to our residents, but we did send mailers to make sure they registered to vote. But it's on our website still to like right now, so residents can go on and click, and it's available in our office. So we have it on paper and all those different things. But we
Thank you.
Residents, but
yeah, but whatever way you could reach people, you tried, and that's really important. It's something that always comes up at Baltimore Data Day is how community organizations, community-based groups can collect information or data and share it back, because that's so important, so that the process of learning is not extractive. It's one of the problems with the structures that we live in, white supremacy, big institutions tend to extract from communities and not always give back. And that's what's so important, and why your presentation is really helpful to us, Eean. Thank you. I'll just direct everyone's attention to the chat box. Seema has shared a couple of useful links for us. Last year, there was you can find a video on YouTube where Baltimore Neighborhood Indicators Alliance delivered a session about the Baltimore Blueprint, that public survey, that citywide survey. I would also ask our academic panelists and our Baltimore City Health Department representative, if there are any ways that your organizations are going out of their way to break down vaccine hesitancy, which is real, something that Eean described. Are there ways that you are trying to do that, or recommendations you have?
This is Melissa. I'll just mention one thing that we're trying to help with, and I think Darcy could speak for a while about all the things that the health department's doing. First of all, I just wanted to say that partnerships between Eean's group and academia, and partnerships between your group as well and the city structures are a perfect mix, right, of science and advocacy. And I really think that the more that these groups can work together, the better. I just wanted to say that a separate project I'm working on, funded by Bloomberg Philanthropies, is working with community groups, in this case in the Latinx community, to get community members who are passionate about vaccination to tell their stories on video and put those out for other people to see, and to see what their motivations are for getting vaccinated, and what maybe a lot of them had some initial hesitation, and their stories tell about their journey towards being open to and grateful for the chance to get vaccinated. So that's one way that we're working on vaccine hesitancy, but the health department's doing a lot more than that.
Thank you. Darcy, in our last couple of minutes, did you want to jump in?
Yeah, thank you. I would say the health department is approaching it from multiple different perspectives. I mentioned our vaccine ambassadors who speak with folks in different communities to answer questions about the vaccine and address concerns that people may have. We've also had some social media question and answer sessions about people's concerns about the vaccine. So inviting people to share their concerns and then having a discussion with them and providing resources to help them learn more about their concerns and feel like their issues have been addressed. And then also being available, Dr. Drasa, our health commissioner, makes presentations to different groups and does Q&A sessions to address vaccine hesitancy. We've done some things on Facebook Live, and you can see recordings of those. So I also think, reaching out, we've had a citywide text messaging campaign. You probably got a text message from the health department inviting you to sign up for a vaccine. We also have a COVID-19 call center where you can call to ask questions about getting tested as well as vaccine resources. So I definitely encourage folks to check out the Baltimore City Health Department's website for lots of different resources around vaccination.
Thank you so much, Darcy. Thank you to all of our panelists. We're out of time. I could talk to you guys all day. What I want to say in closing, two things. First, help us make Baltimore Data Day even more spectacular than it already is by going to the chat box and filling in our online survey. There's a link in the chat where you can click and be taken to an evaluation form. Give us some feedback. The last thing is COVID has uncovered all of the cracks in our social, cultural, financial, environmental, and healthcare foundations. COVID has also opened the door for us to fix the things in our society, our country, our city that are broken. And I think folks like Eean at No Boundary Coalition, our partners at the City Health Department, and big institutions like Hopkins are part of the solution. And we all have to work together to do the work of repair, not just to fix the things that are broken, but to make us all healthier and more connected. With that, I'll thank you. You guys are great. Thank you to all of our participants.
I just wanted to thank all the participants. I'm Seema Iyer. I have the privilege of overseeing the Baltimore Neighborhood Indicators Alliance. I wanted to wish Delegate Lewis a very happy birthday. Thanks for lending your time on your birthday. And Eean, hopefully you feel the love in the chat of how many people really enjoyed your presentation. And Emma, Melissa, Darcy, always great to see you. If you can fill out the evaluation, that would be great.